The way the story came about was that we found out that Congresswoman Mary Jo Kilroy from Ohio had decided to go more public with her battle with multiple sclerosis. So recently she decided to make it a bigger deal with her colleagues in the House, and so she wrote a letter to them explaining that she had been diagnosed with multiple sclerosis, which would be considered a pre-existing condition. So without the public insurance option, if she did not have a job, she would not be insured and could not get some very expensive medication that she needed to keep things in check and to keep it from getting a lot worse.
Mr. Speaker, there are too many people in my district and across the country who cannot buy insurance because they are barred because of pre-existing condition. This is one of the many reasons why we need to take action on real comprehensive health care reform.
We see a lot of Congresspeople talking about their own constituents, but it's a little more powerful when it's them themselves. One of the people I interviewed was Debbie Wasserman Schultz, who earlier this year came out in public and said that she had been battling breast cancer since 2007. It was shocking on the Hill because she's not a person who sits, on a bench in the back of the room. She's actually up there doing a lot of work. So she turned around right after she made that announcement and sponsored a bill about breast cancer awareness with Sue Myrick, a Republican from North Carolina who's also a breast cancer survivor.
Recently, I learned I had more personal risk than I was aware of. Almost 2 years ago, as most of you know now, only 6 weeks after a clean mammogram, I found a lump in my breast while doing a routine self-exam. My doctor diagnosed me with breast cancer when I was only 41.
It's tough to measure how much of an impact it actually has. When you do go public with something like that, it does give you a stronger position when you're talking about something like healthcare. You can't tell Mary Jo Kilroy that she doesn't know about healthcare because she is a person with a pre-existing condition and she experiences it personally. So that gives her a much stronger position to talk about that debate.